Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Joining me today is Krista Consiglio-Lahti, physical therapist from Arrowhead Orthopedics. And we're going to talk about weeks 0 to 2 after rotator cuff repair. You've just had a shoulder surgery. What do? We sometimes run into issues with people starting therapy a little early, starting therapy a little bit late. Ultimately, here's a key point. When to start therapy is going to be the decision of your surgeon. So depending upon what we tell you, make sure to talk to your therapist based on that. So these are going to be very, very general rules for what we look for in the early stages after rotator cuff repair. But the first thing I always like to point out is, why are we doing all these things? And this is a model here, and we look at the shoulder blade and we look at the ball. When we're doing a rotator cuff repair, we're pulling the tissues over. So there are 2 points of this video. One of them is when you are in a sling, and Matt is nicely demonstrating this over here too, we want to do 2 things. One, we want to protect the repair. And we protect the repair in a way where I'm going to show you by putting the sling in a way and adjusting the way the muscles are working. But then the other thing we want to do is we want to not have a stiff shoulder. While there's some recent evidence that stiffness in the early couple of weeks after rotator cuff repair is actually indicating the repair is healing, ultimately in the long run, one of the points of a physical therapy program is to kind of get your movement back. So what we're going to point out is, from a surgeon and a therapist perspective, what are the things we look for in the first 2 weeks? So let me at least throw my 2 cents in over here. So Matt wearing the sling, what I look for is, can you rotate your body just a little bit? Is when we're putting this on, rotate it back a little bit more, a little bit more. Sorry, we're going to adjust this over here like this, rotate a little bit more. And so we want the shoulders to be symmetric. And what I ask people to do when they see their first therapist around week 2 is activate. So Matt, show us how he's activating the lower part of the scapula retractors. Maybe I'd call it the lower trapezius, if you agree with that. What we don't want to see is what we often see as a compensation maneuver, where someone's shoulder hiking. Because that tells me that the shoulder is leaning forward. And if you look at my model, that tells us the shoulder is actually leaning forward, which is going to pinch the rotator cuff. So ultimately, by pinching over here, pinch that over here, relaxing the upper trapezius, we know we're protecting the repair. So that's step number 1. Do you have anything to add as far as that goes?
No, that's exactly what I asked them to do. I usually tell them just to think about pinching the tips of their shoulder blades together, not the tops of them. So that way they don't get a double shoulders coming up together.
Yeah, I hear some people say, just pretend there's a rubber band there pulling the shoulder blades back.
Exactly.
So that little bit of scapular activation should not affect the rotator cuff repair, and relaxing the upper trapezius will also do the same. So the first thing is protecting that. Now the other issue is just the position of the sling. Having the pillow in a position where the arm is a little bit away from the body will relax the repair as well. So those 2 things bring the roof over and take some stress off the rotator cuff repair. Do you have anything else to add in the first 2 weeks?
Regarding the shoulder blade, I do have them do some side lying exercises typically. I like them just to, it's a scapular clock, just to get this shoulder blade moving in all the directions.
So you will start them activating in different planes.
Correct.
Okay. Okay. And let's have you rotate around, Matt. And are there any other issues that you would want to bring up as far as protecting the shoulder in the first 2 weeks?
Don't lift it. Don't lift it to put it into the sling. Don't lift it to put on your shirt. Don't pick it up, because that's what's going to get all your repair stuff loose.
So that's a great point that Krista brought up, which is the difference between active range of motion and passive range of motion. So most of the time after a rotator cuff repair, when you fix the muscle, the point is to protect that muscle. And we do it in 2 different ways. One, by positioning the arm in a way where you're not pulling on the muscle, and the second is by not activating it. So active range of motion means you are lifting the arm up. Now the problem with the rotator cuff repair and recovery is we're asking people to do things that are very unnatural. Correct. We're saying your whole life you've spent doing things. There's evidence that if you use the other arm to grab something, you fire this same arm. So we ask people to be very, very careful. And while we let you use your hand, wrist, and your elbow, we want to not have any active motion. So active motion means you're picking the arm up. Passive motion, which is generally what we recommend after a rotator cuff repair, means you are going to be slowly lifting the arm up. And that is typically started, depending upon the type of repair, which you should check with your surgeon, between weeks 2 and about week 6. Would you agree with that?
Yes.
And what are you finding is the most common period of time when motion is started after rotator cuff repair?
again, with the smaller repairs, we start people as soon as a week.
Okay.
So passively with
quicker.
therapy.
Yep.
I don't usually have them do their own passive at home for the first few weeks. I usually let that start about week 2, 3-ish, a little further out sometimes, depending. However, when they're in with a skilled therapist, somebody who knows what they're doing, it's a little sooner.
Fantastic.